But I am MariaKunstadter. I am a dentist and have been a dentist for a very long time. I get obviously a mother and a grandmother. Those are the things that I love to do the most is teledentistry in my family. And our mission as the teledentist is to provide access to oral health care providers globally. I mean, we are the oral disease is the most prevalent disease in the world. And it's almost 100% preventable. And the reason it hasn't been decreased is that people don't have access to a person that can tell them what they need to do, what they should do, and how to take care of themselves. And so many people don't have access, rurally, big cities, if they don't have the money or the funds. So with technology, which is a wonderful thing, we now have access at the tip of your fingers. I call the cell phone, the best health tool ever invented. Yes. Because from it you can get consultations and advice from all sorts of providers, and through the teledentist, and now through Cura4U, people can contact a oral healthcare provider and find out what they need to do, what's going on. So our 3 pillars of teledentistry that we do are educate, palliate, and triage. So someone comes to us and we educate them on what's going on, what needs to be done, what will happen if they don't take care of themselves, and the good outcomes, and make sure that they understand what's going on with their oral health. Then we can palliate them if it's an urgent or emergent condition. We can do e-prescriptions. We can get medications to them. Again, it goes back to the old, you don't know what you don't know. We can get them to get over-the-counter products that they don't even know are there. For instance, a big hole in a tooth, temporary filling material. People don't even know that's in the aisle of retail pharmacies. So then we palliate them on the current thing that brings them to us. It could simply be my gums are bleeding. Again, you guys are in oral health. So their gums are bleeding and they need to know what's going on and why and what to do about it. And then our 3rd pillar is triage. And we take these people, and if they do not have access and they need hands-on care, our company takes the responsibility of triaging them to the right center, the right facility to get hands-on dental care. Why teledentistry was done? It was basically back in 2014 when the American Academy of Dentistry, the ADA, said that 2.2 million people were going to emergency rooms for dental emergencies. And that was, back then, it was $2.1 billion healthcare dollars being spent in emergency rooms where no treatment is given, no care is rendered, and then they always are just told, go find a dentist. And that, if it was that easy, they may not have been in the emergency room in the first place. So my sitting at a table at a conference, there were a lot of physicians that were already doing telemedicine. It was like, perfect storm. That's what we need. We need virtual dentists in all the places people go besides the dental office for help with oral health problems. So that teledentist was born. Again, in the United States alone, 50% of the population does not have a dentist. A lot of them may have dental insurance or Medicaid. They don't use it. The insurance industry knows about 43% of people never use their benefits in dentistry. So there are 50% of the population out there that don't have a dentist to access, but they can Google help with a dental need, and they find our site on a search engine. And then they can contact a dentist and get the right information, the right education, understand what's going on, and then any further care that's needed, we manage that. Now, in our post-patient surveys, 43% of our patients said their needs were addressed at the time of the consultation. A lot of times it's not a broken tooth. Sometimes it's a broken tooth or an abscess. But a lot of times it's simple things like people don't even know that canker sores or aphthous lesions are, actually not going to kill them because it hurts so badly, or again, fever blisters is the generic, but the herpes infection, they don't know that this in their mouth or on the edge of their mouth is not going to get worse. And people really love, we have a 95 net promoter score. 95% of the people say they'd recommend us, because people just don't know some of the things that the basic professionals know. And when they talk to the right professional and get help, they feel so much better immediately because they understand what's going on. I love providing access to the members. And on Cura4U, again, I think insightful telehealth companies add oral health specialists. And I was thrilled when we made a partnership and to be able to add oral health, because oral health is pivotal for total health. I mean, you can't have good health without good oral health. So this gives us the opportunity for, Cura4U physicians to say, hey, when was the last time you were at a dentist? You need to talk to the teledentist and find out what needs to be done. Gives us a chance to say, you may have underlying diabetes as badly as your gums look. And we'll refer back to the physician for them to proceed with a physical kind of care that a physician can provide. So it gives the medical dental integration wings that we could actually work together for total patient health. Perfect question, because what we have done, because we've been in business since 2014, so innovative idea dental companies come to us all the time. We have taken the cream of the crop, and not only do we provide urgent emergent consultations, but through Cura4U, patients will have access to getting tooth replacement appliances, sleep apnea studies and appliances, AI assessments, second opinions. Another thing that people really find, if they've been to a dentist, they get this treatment plan and they're like, do I really need all this? This work sounds like way over the top. They haven't been for years, but suddenly they have all this expense. Well, they can get a second opinion from an arbitrary dentist that will look at their x-rays, look at what's been recommended, and help them understand what really needs to be done and feel secure about proceeding with their care if they need an outside resource to understand that. So AI checkups, tooth replacement, sleep apnea. We have a whole gambit on Cura4U of dental, we call it virtual dental care program, which does not substitute for routine dental exams and cleanings. But for those people that want to have other devices and other appliances and other needs that can be managed virtually, we have all those available on the platform as well. Well, I am thrilled with Cura4U, including oral health as part of the platform of good health. Again, without good oral health, you can't be healthy, and it affects so many chronic diseases. Pregnancy, childhood, we deal with children all the time. And when we can actually get into the prevention mode where we can see people before a huge problem arises, then we can help them address the problem, get it taken care of much less expensively, even sometimes just through the telehealth program, and be able to address their oral health needs in a timely fashion to all of your members. And again, if there is some underlying medical condition that needs to be dental medical integration, this is the perfect platform for that. And thank you. I know Cura4U is doing some really virtual hospitals, and there's so much research out there that impacts when it gets down to impacting the individual. But research has shown oral health is critical to hospitalized patients, because as you think of them laying in bed going, I'm a very visual person, but they're expelling, if they don't get their teeth, and they don't get their teeth cleaned, they're expelling all the bacteria all around, and then they go and do wound care, and all this is, microbes all over their bed, inhaling it all. With poor oral health in hospitals, patients acquire hospital-acquired pneumonia with a higher frequency. So this platform gives us the opportunity to actually take the research that shows even diabetes patients, a 45% reduction in their A1Cs scores annually by having good oral health. So being able to be connected to patients where they're connected with physicians and dentists means your patients, our patients, now we'll talk collectively, our patients will be healthier and have healthier families and healthier outlooks by being able to access all specialists.